Let's start with one of those headlines. The chairperson for the Council for Medical Schemes, Dr. Clarence Mini, has died from COVID-19 complications. Dr. Mini had been in hospital for more than a month. Well, on the line we have Grace Khoza, General Manager for Stakeholder Relations at the Council, which of course regulates medical aid schemes. Ms. Khoza, thank you for being with us. We hear the death stats every day, but this is real for you and your organisation. Can we start by your tribute, your remembrance of Dr. Clarence Mini?
Thank you, Francis. Dr. Mini was a leader. He was a very passionate leader who really believed in making sure that everybody who was contributing, at CMS as a regulator for medical schemes, understood that at the end of the day, what we needed to achieve was to protect ordinary members of those schemes. I got to know him because I also realized that he was a mentor. He was a father who believed so much in young talent in this country. He had a phrase that he would say quite frequently when he saw potential, that person's got it. And he would say the least that we can do is to create an environment for that it, meaning the seed, that spark, to grow. And I was fortunate, like many others, to be part of that it where we grew and we excelled because of his dedication and support.
He was in hospital for more than a month. This sounds like a mammoth battle. How did he contract the disease? Just tell us a little bit more about that struggle.
We're not sure how he contracted the disease, but what we know that it was a painful journey. He was one of those people who was absolutely caring. So it could have been in one of his interactions. He was one of the warmest leaders we had, the regulator. So it could be in one of those encounters. But I think the biggest lesson for us is that it's possible for this disease to spread and even attack people who are clinicians, who are doctors, medical doctors, and have been practicing for years and have been absolutely dedicated in ensuring that we all knew and understood what was coming to us as a people, as a country. Yeah. But unfortunately, he also succumbed to COVID-19.
For a month, do you feel he was given adequate medical care? I mean, often we just talk about the death stats. We want to know how this journey went. Do you feel he received all the support he could while he was here?
Yes, he did. I mean, initially it was very tough for the family, and he was later on moved from the initial hospital to another hospital where he got the best, we think, and we shared this with the family. We got this information from the family. Really good attention from the medical staff. And to be honest with you, Francis, we didn't see this coming because on a daily basis we were getting good reports up until literally last week, Thursday. But having said that, we still were hopeful because Dr. Mini is a fighter. I mean, this is a wise old man who, like many others, sacrificed, went into exile, lived in some of the most challenging environments in exile, but came back and still dedicated himself. So as a fighter, as somebody who was stern and believed that it's possible to be a change maker, and he felt, I mean, we remember some of the last conversation, he felt that he had not ended his journey, you know, in contributing positively in the healthcare space. So we knew he was still wanting to fight on. Unfortunately, he ended the way it did.
We are very sorry for your loss. Were any other colleagues at the Medical Council affected?
No. Those who were exposed or who had the last encounters with him did go for medical checkups, and we are fortunate to say thus far nobody has came back with a positive result. But we are mindful of the fact that this is an unpredictable pandemic, and we all just needed to adhere to the rules, the strict rules as per government prescript. And I think it's important. And the message to everybody at home is that let us not take this for granted. You know, for us it's now hitting home because we've lost a beloved leader, a father figure who really cared about this industry and its people.
Yeah. It's a pandemic that also makes it hard to even mourn the dead. Funerals are hard. Do you know what the family is doing right now?
No, I mean, they have obviously just received the news last night, and I think as the family, they will, at the right time, inform us as the regulator, and we will notice those who are interested to know what will be happening in the right platforms. But as of now, we really don't, and we believe strongly as the regulator that there's a time to give the family space. Come on. Come on.
All right, thank you very much. That was Grace Khoza, General Manager for Stakeholder Relations at the Council for Medical Schemes, remembering there Dr. Clarence Mini.